We will start this session. Hello to everyone from wherever you're joining. So thanks to participate and join us today in the third session of our viral hepatitis webinar series for country program managers and policymakers. We're starting to see a couple of familiar faces and names. That is really nice because it is intended to be a session where we're always a similar group and we can ask questions and exchange and learn from each other. My name is Niklas Luhmann. I work here at the headquarters in the Global Hepatitis Program and in the Department for HIV, Hepatitis and Sexual Transmitted Infections. We do excuse our program lead this morning, which is Dr. Lesi, who has been called into a high-level meeting with the Minister of Health in Ghana. And she might join us later if she can, but she's in the meeting in the moment. As well, we're here with an expert team of colleagues from HQ, from the regional office, and country offices. And the goal, as you know, of our meetings is really to exchange knowledge and share implementation experiences. And it gives an important place to other countries to share their experiences and their work. So today's session will look into the topic of developing and costing national strategic plans for a structured and transparent response to viral hepatitis. We really want to learn, and we hope that we can hear from different countries today and from different colleagues with different experiences, and to understand how national planning is a key element to the national health response in viral hepatitis. And we hope to hear from the participants, your questions, your contributions, and your learning as well, as I said already. So now, if you could please put your names and affiliations in the chat as a way to introduce yourself, that would be nice so that we can learn who's online. Next slide, please. So just very quickly, this is how our agenda would look like today. I will hand over now to my colleague who leads the strategic information work, Diana Faini, with housekeeping and the Zoom poll. And then we are very pleased to have Dr. Banda from our headquarter department, who has very long experience in country support and national strategic planning to present. We then have two presenters, Dr. Busi and Dr. Khomotso from South Africa, sharing experiences in integrated planning, and our colleague and friend from the regional office, Dr. Revari, will then lead both discussion sessions. So this is the first session with a facilitated 10 minutes discussion, we hope, and then the second session where I will have a short introductory talk on the importance and learnings on costing national and operational plans from a grant that we implemented last year. And then our dear colleague from Sudan, Dr. Abdullah, will share her experience in this area. And again, the facilitation by Dr. Rivari, and we will wrap up. So that's the session today with two sub-sessions, and we hope it will be useful for you. And again, thanks for joining. I hope I will hand over to Diana. Thanks.
Thank you, Dr. Nicholas. So to begin with, we'd like to get into touch with the housekeeping for this session and all our sessions. Be aware that we have translations available in English and French. Do press the interpretation icon to be able to hear the language of your choice, and please mute the original audio if you want to hear the interpreted language only. You can also see live transcriptions, which will allow us to easily follow the sessions. And we ask you to be very active in the chat session to pose any questions and any discussions so as to keep this session alive. We kindly ask you, when you're using the chat session, to minimize the use of acronyms so that our interpreters can easily follow with your comments and questions. Again, we kindly ask you to rename your Zoom ID and identify yourself. We realize that we may use different Zoom IDs, and we want to be able to know who we're speaking to. Kindly rename the Zoom ID using your first and last name and your country. Be aware that this session is recorded, and that this recording, the PowerPoint, and all other resources shared in this session will be available to you after the webinar. And we kindly ask you to use the link that will be provided later after the session to be able to provide any feedbacks. So, starting with our day-to-day, we want to gauge and see where you are in terms of the national strategic plans for viral hepatitis, and we have three poll questions to take us through this. Romina, if you could please display the first poll question. So our first question is asking, is there an approved national strategic plan for viral hepatitis in your country? So we want to know how many countries do have an approved NSP for viral hepatitis in their countries. Good to see some responses coming in, and I see most of those who are joining us today do indeed have an approved NSP. We do have some countries, some participants mentioning that they do not have. We do have 14 of our 30 participants responding. We kindly ask you to take the polls so that we may better understand where we are in NSPs and see how best to formulate the discussions today to be of use to you. Thank you all to those taking part in the polls. We ask you to go ahead and finish the poll so that we can get to the second poll questions. Romina, if you could please project the results for the poll 1. Romina, could you please end the poll and project the results for the poll 1?
Hi, Diana. The results are already on the screen.
Thank you. We see that we have 81 of our participants today saying that they do have an approved NSP, and we're glad to see this. I hope this session will be useful, and perhaps we can have more countries having an approved NSPs by the end of this year, perhaps. Second poll questions, please, Romina. Could you please project the second poll question?
Hi, Diana. Yeah, just give us a second. There's some technical glitch. Manjeet, could you try launching the second poll?
Sorry.
So while we're waiting for the poll to be projected, the second poll question will be asking you if your country has a national strategic plan for viral hepatitis, and if this plan covers the responses to viral hepatitis only, or if it is integrated with HIV. We want to know if your NSP is standalone for viral hepatitis or whether it is integrated and does include HIV. Thank you to all taking part into this poll questions. I see more responses coming in, and it's good to see more 50% of people responding do have a standalone viral hepatitis plan, and they are nearly 44% having an integrated plan. We ask you to all take part in the poll questions so that we may be able to structure this conversation today to be more specific to the needs of the countries. Good. Romina, if you can end the poll and project the results for the participants to see.
Let's just end the result.
Yeah. So 57% of our participants do have a standalone viral hepatitis plan. 33% have an integrated plan with HIV, which is good to see as we're advocating for an integrated disease approach and cross-country. And some countries at this particular moment do not have an unapproved NSP yet. And we hope the experiences shared in this session will be able to move these countries better to have one approved plan perhaps soon enough. Thank you all to those who took part in the second poll question. Romina, if you could please project the third question. As the question is coming up, the third question is asking if your country has a national strategic plan for viral hepatitis, and if this plan is fully costed, if it is not costed, and whether you do, and for those who do not have an NSP yet, the answer will be non-applicable. Good to see responses coming in, and it's good to see some countries do actually have a costed NSP, as this is one of the advocates for global health strategy. We see that some countries do not have a costed NSP, and perhaps during this discussion we'll be able to better understand why this is important and how countries can better have a costed plan for the NSPs. Thank you all to those who took part in the polls. We have 52 participants taking part. Hopefully to see this number rising before we close the poll session and hand over to the first presenter for today. Would like to know in the chat, perhaps, if your country's plan, for those who do not have a costed plan, perhaps if you're planning to have a costing section in the plan, and whether why not, and what kind of support you need from WHO country offices, regional, so as to be able to have a costed NSP. Thank you all for taking part in the polls. Romina, if you could end the polls and project the results.
Yes, Diana, the results are on the screen. Thank you.
Thank you. So we have 38% of our participants who have the plans costed. We do have a 48% who do not have a costed NSP, and I think Nicholas will take note of this and we'll discuss this during his session, and of course with reflections from other countries. And we do take note of the countries who do not yet have an NSP, and I believe this session will be very useful to take forward your country plans into having an NSP. So with this, we end the poll session and we take note of the results, and we'll come back to them during the discussions of this session. And going forward, I'd like to start our first presenter of the day. If we could end the polls, Romina, so that we can start the slide for the first presenter. Our first presenter today is Dr. Mazur Banda. Dr. Mazur is the lead for the HIV unit in headquarters WHO with over 20 years of experience. And I think of no one better to take us forward in this session today, where we can tap from his long-standing experiences and share what he thinks in terms of the integrated NSPs. And he led the process of developing the guide for NSPs within WHO HQs. So welcome, Dr. Mazur, and I hope this session will be very useful for our participants, and we'll get to have more and more countries developing the NSPs. Thank you, and over to you, Dr. Mazur.
Thanks very much, Diana. I hope you can hear me still. Okay. So thanks for the invitation to this forum. It's quite a privilege for me, and I really appreciate that this forum is considering very practical issues like developing national strategies. So my remarks will be more introductory, because I think the crux of the issues will be in the country example that will follow for South Africa. But I will just highlight some key points that we need to take into account with respect to strategic planning for viral hepatitis. So go next slide, please. Okay, so I think we should start with the question, why put efforts on national strategic planning? Now, one important issue is that national strategic plans are an expression of a country's aspiration to achieve goals. So if a country wants to achieve something big, they develop a plan, a nationwide plan, which is translated at different levels and is implemented towards that goal. So if a viral hepatitis is considered a goal to be achieved in the country, there will be a plan. So, as I say, if something is considered important, there will be a plan developed to achieve it. So, for instance, for countries that have high burden of hepatitis, viral hepatitis, they must have a plan, to deal with with that challenge. If there's no plan, there will be no achievement, because the efforts will not be guided, they will not be measured, they will not be funded, and they won't be implemented. So a plan is a framework for achieving all that. Then a good plan that's made, very sound, based on evidence, and selecting the right priorities and so on, is more likely to help the country achieve the desired impact. So strategic planning is crucial in handling major global national health challenges, particularly in the case of viral hepatitis for countries affected. Next slide. Towards the end of 2021, we conducted a desk review of existing national strategic planning documents from all countries, whether they were high-income countries, middle, low, and so on. We retrieved about 179 different national planning documents. And in those, interestingly, we found 60 existing NSP documents addressing viral hepatitis. We were somewhat pleasantly surprised, because other programs like HIV have had the culture of encouraging national strategic plans for quite a number of years, over 30, 40 years or so. But we were not sure what to find with respect to viral hepatitis, but 60 is reasonable. Needs to increase, because the burdens of viral hepatitis globally are higher than, for instance, HIV. So next slide shows the type of documents we found. If you can go to the next slide, Sandy. Okay, so these are the, some of the documents we found. HIV only national strategic plans. For hepatitis, we found 48 national strategic plans standalone for viral hepatitis. We found 9 were combined with HIV, hepatitis, and STI, and a few which were just 2 for HIV and hepatitis, and 1 for hepatitis and STI. So they were in various forms of combination as they exist now. And as you will see, going forward, we are encouraging more integration among the programs so that they benefit from each other's strengths. Next slide. And within these, we selected a few to go deep into the content, the nature of the content of the NSPs. As you see, it's depicted on these slides. So we looked at the evidence base or the situation analysis, how much robust the situation analysis was. And as you can see in purple, where what we found with respect to viral hepatitis NSPs. We found that the weakest portions were that they had probably less description of the national context. They didn't have much incidence mortality prevalence trends depicted. Social determinants of health were not usually well covered, and the description of the national health system tended not to be covered well. So they tended to be very technical on viral hepatitis, rather, and not often looking at the contextual, the context, the socioeconomic context as well. Next slide. Then we looked at the aspects of viral hepatitis, a few of the key aspects of viral hepatitis, which may have been included in the plans. But here, as expected, we found that the key elements or the key interventions or services were fairly well covered in most of them. Next slide. Then we looked at the aspect of financing, which was interesting. So as indicated in the polls, there was some differences in terms of how much financing was covered in these plans. We found that there was a significant number that had comprehensive budgeting and costing, though not many. We found there were much fewer hepatitis strategies, which discussed the funding landscape. The funding landscape simply means what resources are available or potentially would be available, to finance viral hepatitis programs. So there wasn't much description of that, and we didn't find any that highlighted resource mobilization plan or how they'll go about mobilizing resources. So the assumption was that the plans were all going to be funded from government budget, so there wasn't much effort to look at what else might be available. So that's an issue to consider for viral hepatitis planning and for integration, because for HIV, at least there has been quite some effort to look at many alternative sources of funding. Then if you go to the next slide, so as Diane has mentioned, we have just developed a guide for national strategic planning for HIV, viral hepatitis, and STI. It's a combined guide for the three diseases. We are currently in the process of going through the clearances internally and publication. So within the next few weeks, the guide will be published and will be available publicly on the website for use by the countries. Next slide. And the guide, the purpose of the guide is as a tool for national level implementation of the global health sector strategies, for HIV, viral hepatitis, and STI, which passed through the World Health Assembly last year. Secondly, it's meant to assist with aligning these three programs within the broader national health setting and the priority planning. There were other considerations. We're trying to emphasize priority setting, integration, and delivering people-centered services. Next slide. Okay, so this slide just highlights the structure of the document. We have structured it in three parts. The first part is more of the background and context. So we talk about the primary healthcare context, the global context with respect to achieving the Sustainable Development Goals, and so on, and what are commonalities within the health system across the programs. Then in the second part, we are now talking about core components of the strategic planning, what should go into each strategic plan for the programs. And this part, we've divided it into general descriptions, but also disease-specific modules. So there will be a module for HIV, which talks about the essentials for HIV, whether it's a situation analysis, setting priorities, monitoring, evaluation, service delivery, and so on. The essentials for viral hepatitis, the essentials for STIs. And then we have also included a module for integration across, taking advantage of all the commonalities across the programs for service delivery. The third part is more of practical considerations after the plan is developed. How do you get it through approval, and how do you implement it? So as I said, this is already in process, and WHO will be sharing it as soon as it's published, which will be in a matter of weeks, and they would encourage countries to use it as much as possible. So that's all for me for now. Thanks.
Thank you so much, Dr. Mazua, for those introductory remarks. And it's good to see the results from the desk review on where countries are in terms of the NSPs, and really highlighting that if a countries want to achieve goals in eliminating hepatitis, then they need a strategic plan to be able to know how they're going to cost, where they're going to mobilize resources, how they're going to measure their achievement, and to know what they have achieved over time. Thank you so much for those remarks, and I hope we can come back to you for any questions during the discussion sessions. Next slide, please. Going forward, I'd like to now introduce Dr. Busi and Dr. Kimotso, both from South Africa, to kickstart our sessions. We understand that we're a little bit behind time, and we hope we'll be able to catch over the next sessions. Dr. Kimotso is the National Viral Hepatitis Lead, and she participated and contributed of the development of NSP in South Africa, initially when viral hepatitis was together with HIV, TB, and STI, and later on when the NSPs for viral hepatitis were separate. And Dr. Busi, she is the National Professional Officer from the WHO Country Office in South Africa. She's also the member for the reference group of the NSP development, and she provided oversight during the process of the NSP development in South Africa. We're excited to have them both in this session for them to share their experiences, and we hope that our participants will have a good learning from the experiences in South Africa and how they can better structure or better implement the NSPs. Welcome to you, and hand over to you, Dr. Busi and Dr. Kimotso, for the presentations.
Thank you very much, Chair. I'll start with the first few slides, and then Dr. Kimotso will join me. Please go to the next slide. This is the outline of the presentation, just highlighting the different issues that we'll be talking about: the global burden and priority of viral hepatitis burden in South Africa, the NSP development, clinical guidelines, the proposed changes in the current NSP, and the challenges and what to do next. Next slide, please. So WHO recommends that we should prioritize integration of the three epidemics, which is the HIV, the viral hepatitis, and the STI epidemic, because they are inextricably linked. The WHO Global Hepatitis Sector Strategy for HIV, viral hepatitis, and STI for 2022 to 2030 is the guide that helps countries to integrate these responses. Basically, there are different strategies that have been highlighted in this guidance, but more importantly, what I would like to highlight is that it prioritizes people to be at the center of these strategies. Next slide, please. When we speak about elimination of mother-to-child transmission, the current thinking now is that we need to integrate HIV, syphilis, and hepatitis B. And the rationale for this integration is that all three infections are actually interlinked. They are all transmitted sexually and vertically from mother to child. They are often silent with long latent periods, and the infected mother may be unaware and having no symptoms, and they can be identified during antenatal care and treated to prevent vertical transmission. And they can also cause significant maternal and child morbidity and mortality. Next slide, please. So this highlights the the South African picture in terms of hepatitis B prevalence. And we're saying that South Africa has one of the highest hepatitis B prevalence at 6.7% hepatitis B antigen seroprevalence, and an estimated of 3.4 million persons are affected globally. And if you look also at the hepatitis C burden, South Africa has a moderate hepatitis C burden. Next slide, please. So I'd like to highlight the process that we went through when we were developing the National Strategic Plan in South Africa. Just highlighting how the hepatitis component was included. The guiding document, which is the country's HIV, TB, STI response, it's a 5-year national strategic plan. And for 2017 to 2022, it coordinated by the South African National AIDS Council, which is SANAC. So the NSP 2017 to 2022, it had a limited focus on TB, even though TB was included. Secondly, hepatitis C was just mentioned briefly as part of people who inject drugs. It was not included in detail. So with the development of the current NSP, which is 2023 to 2028, there was a lot of advocacy for meaningful inclusion of hepatitis. And this advocacy and request for inclusion, it was very challenging. There was a lot of pushback, but eventually viral hepatitis was, however, included in the NSP, with the hepatitis B being under the STI program, as well as the hepatitis C under the people who inject drugs. More importantly here, we want to emphasize that there was intentional advocacy, there was a mobilization of information and raising awareness in the importance of having the 3 diseases treated together. So we only have these 2 inclusions at the moment, and we think that it's a success, even though we're not there yet. The next slide will be presented by Dr. Khomozo. Thank you.
Thank you, Dr. Busi. The National Clinical Guidelines of Viral Hepatitis and the Viral Hepatitis Action Plan, which is a 5-year action plan, were approved by the National Health Council. The National Health Council is the minister and the officers, like other ministers, that are responsible for health in our 9 provinces. The development of this guidelines and action plan was supported by the country office of WHO. The guidelines include the introduction of new direct-acting antivirals for hepatitis C. They also recommend that we adopt the hepatitis B birth dose for newborns. Again, the guidelines were used to develop an action plan. That is, the action plan actually made the guidelines very practical. The 2019-2024 National Viral Hepatitis Action Plan of the country covers 5 priority areas. Number 1 is to raise awareness of hepatitis viral infection amongst healthcare workers and the general population. This is because during the development of the guidelines, it was obvious that there's little knowledge and information on viral hepatitis in these 2 populations. The second priority area is to strengthen knowledge of hepatitis burden of disease. We do not have a routine surveillance in the country. Whatever data we have is from the National Institute for Communicable Diseases and from other studies that have been conducted around the country. The third priority area is to prevent transmission of viral hepatitis through education, vaccination, diagnosis, and treatment of those who are eligible. The fourth priority area is to improve diagnosis and treatment of chronic hepatitis infection. We do not have like rapid diagnostic tests that are routinely or readily available in our public healthcare centers. And the fifth one is to establish a management and coordination unit to facilitate the use and implementation of evidence-based policies, and also to be able to supervise the implementation of the Viral Hepatitis Action Plan. Next slide, please. So the inclusion of viral hepatitis in the NSP for 2023-2028 has got two key objectives. The first one is to scale up prevention through vaccination of our newborns, and then diagnostic testing for hepatitis B of healthcare workers, key populations, specifically our people who use or inject drugs, pregnant women, and people living with HIV. We also need to scale up harm reduction programs for people who inject drugs or use drugs. And the next objective is to increase diagnostics by implementing HPV diagnostic testing and treatment of healthcare workers, pregnant women, and people living with HIV. We also need to implement targeted hepatitis C diagnostic testing and treatment strategies for key populations. So what are the implications and opportunities for viral hepatitis integration in this new NSP? There will be heightened awareness of hepatitis as a public health concern. The NSP strategic plan in our country is actually overseen or by the South African National AIDS Council, and the South African National AIDS Council is a multi-sectoral organization with membership from different government departments, corporate sector, private sector. So there is a lot of resources from those companies or organizations. This will also be an opportunity for integration and shared approaches to planning and delivery. The health sector approach to managing the three interlinked diseases will also be strengthened. There will also be renewed commitment from the various sectors that I've just mentioned. And then funding for viral hepatitis. This will ensure that we have additional resources and that we can be able to actually mobilize resources through the use of this and the implementation of this NSP. Next slide, please. So what were the challenges that we faced? I mean, the action plan was approved in 2018. And other than the obvious, which was the pandemic, we have challenges with insufficient funding. We do not have dedicated funding for viral hepatitis. We have to use the routine health service funding. We also have human resources challenges. We've got staff shortage, and the staff that we have doesn't have adequate skills to manage viral hepatitis. Another challenge was access to medicines. There was a delay. I mean, the pharmaceutical companies actually submitted the dossiers in 2014, and the DAAs were only registered in 2020. And after the registration, there was also a delay in the publishing of the single exit price. So the only way we could access DAAs for those who were eligible and infected with hepatitis C was through Section 21, which is individualized. So what next? So we need to increase advocacy for funding, especially for diagnostics, to ensure that if we want to roll out the activities within our action plan, we need to have access to diagnostics. We need to have access to vaccines, especially because now we'll be implementing testing for ABSAG in our antenatal clients as of 1st of April 2023. We'll also be continuing vaccinating our healthcare workers. We also need to ensure that human resources are developed and trained in the management of viral hepatitis. And of course, access to medicines. The discussions are also ongoing with regards to costs of these medicines. Thank you.
So good morning, good afternoon. I am Dr. B.B. Rivari, Regional Advisor for HIV, Hepatitis, STI at WHO CRO. Thank you very much, Dr. Komotso and Dr. Busi, for an excellent presentation, sharing how you have transformed a standalone viral hepatitis program into an integrated national strategic plan for hepatitis, HIV, TB, STIs, and how you have shared your vision on the shared approaches and how this will benefit the country in moving ahead on viral hepatitis. So now we have some time for discussion, question, answers. And I would just like to emphasize this is an interactive session where we learn from each other. So we'll be grateful for your inputs, questions, sharing experience. The participants are requested to kindly share in the chat, or if you want to ask a question, please turn on your camera and ask your question. And please specify your question to Dr. Mazuva, Dr. Kumutso, or Dr. Busi. So the session is open for discussions. Don't see any questions, but you wait for the questions. I would just like to ask Dr. Kumutso, basically, what were the challenges that you encountered? What were the specific challenges in integrating the program? Because normally there are some kind of issues of silos between the HIV program, which is more a vertical program in most countries, and hepatitis program. So how did you overcome those challenges? If you can briefly explain that. Thank you.
Thank you for the question. Viral hepatitis, unlike HIV, is not well known. It was our experience even during the development of the guidelines that even reaching out to clinicians, most of them would say they don't have enough knowledge about viral hepatitis, its management, and etc. And the other issue was that we actually don't have specific funding for viral hepatitis, and the funding that we have is mainly for HIV and TB, and it is dedicated funding. So when we indicated that we need to include hepatitis with HIV and STI and TB, the commonest question we got was, how are we going to get the funding? Who's going to be responsible for that? Are we going to, our healthcare workers going to be able to get this added intervention to manage patients again for this condition? Yeah, I think that basically the issue was just the funding and the lack of knowledge, and viral hepatitis being an orphan, you know, as an orphan, you are not well known and you're easily forgotten. So I think that was the main issue. And advocacy is not as high as it is for HIV and TB. The community also doesn't know much about viral hepatitis. We have tried our best. We've had World Hepatitis Day commemoration since we started with the development, even prior to the approval of the guidelines from 2015. We've had national commemoration. Even during the pandemic, we'd have even virtually sessions like community dialogues. People who have hepatitis C or hepatitis B would be sharing about their experiences, just to make sure that we create and increase awareness on hepatitis.
Thank you, because these were the two specific questions which came in the chat while I was asking you. And that the question specific was funding implications of integrated national strategy plan. Did it lead to increase in the funding? So I think you have partially answered that, but it is more of efficiency that I think comes in with the integrated planning, particularly when you have shared actions where you have cost saving and cost sharing. So that also helps basically in bringing it down. So are there any other questions in the chat box? I don't see any questions. Or anyone wants to ask a question?
There's a hand up from, and there's a nice question in the chat, Dr. Rivari, maybe the person.
So maybe Sarah has raised his hand. So maybe Sarah, you can go ahead, and then I'll put the questions. Yeah.
Okay, thank you. Thank you, Dr. Komozzo, for the comprehensive presentation. Mentioning the funding, I'm wondering if South Africa is an global fund eligible country for for fund of regarding the ATM, and if your country is eligible one, I'm wondering how did you consider integrating, because the global fund are now opening the window for the integrated viral hepatitis activities with HIV, especially for elimination of viral hepatitis and STIs and HIV among pregnant women and the prisoners and BLS HIV plus the key population. Thank you.
Thank you, Dr. Sarah. Yeah, South Africa is eligible, and we do have global funded projects around the country, even for hepatitis. The Global Fund is funding hepatitis C activities, specifically for people who inject drugs, but it is at a very small scale. We are aware that they have apologies. Yeah, we are aware that they have indicated that they will also be funding activities around triple elimination of HIV, viral hepatitis, and syphilis. And as a country, we are interested in actually bidding for and developing proposals for that. Thank you.
So please go ahead, Pascal, you want to ask a question? Hello. We can hear
Oui, il y a
you
une
now.
question, s'il vous plaît. Voilà, Pascal Tiamala de la RDC, de la République démocratique du Congo.
We can't hear you.
Merci, madame, pour votre présentation.
We can't hear you. Maybe you can just post it in the chat box because there is a lot of echo.
Oui.
Hey, Pascal, it looks like you've logged in from multiple devices. We request you to kindly leave the audio from the remaining devices and only have one of the audio.
En fait, Monsieur Pascal, vous êtes connecté avec plusieurs appareils et alors on a un écho très fort quand vous parlez. Il faudrait que... Sinon, est-ce que vous pourrez, s'il vous plaît, partager votre question dans le chat? Maybe I can propose, Dr. Rivari, that we continue and we have another discussion session where we can hear.
So yeah, so we have very important questions which have come up on funding, basically, whether the integrated plan led to increase in funding. And we have some people who have joined us from Hepatitis Fund. Can you share some reflections on the resource mobilization that Hepatitis Fund might have helped, or how can we help once we have integrated strategic plan that of course leads to increase in the cost? So maybe somebody from Hepatitis Fund can respond. Please go ahead.
Yeah, thank you. Thank you so much for giving me the floor, Capucine Penico from the Hepatitis Fund. It's great to hear about the South African experience and projects for integration. I'm really happy to hear that. And I echo this we're working with a different set of countries on the integration agenda. And I really feel that many countries are going to move forward with that integration. So really happy about it and happy to provide support in doing so with the Clinton Health Foundation, of course, WHO. I think that's a very important part of what we can do today. On the other side, so we are more a philanthropic organization, and we're really glad to have worked with WHO on the costing of some national plans for some of you. We think that makes a big difference, and we're hopeful that we can continue that in the future. We really think that, of course, the domestic responses are the key, first of all, and that's where we need to work on the systems in place to allow integration. Right now, we're realizing that some countries, they really need to have shared strategies like HIV and hepatitis policies together to be able to make some accelerated progress towards hepatitis elimination. It makes sense in so many settings, not in every setting. So that's really an approach that we support and we want to keep supporting.
Thank you. Thank you for that response. We have a question for South Africa, whether they have implemented elimination for general population or only for HIV co-infected with HCV, HBV. Dr. Komotso, you may like to answer, but we saw in your presentation that you are focusing on different groups, including healthcare worker, pregnant women, PL-HIV, but you may like to answer it further.
Apologies, Doc, there was some disturbance in the background. Can you kindly repeat the question?
The question is basically the elimination plan for hepatitis B, C is for general population or only for HIV co-infected with HCV or HBV? That is the question.
Thank you for the question. It is actually for the general population, but due to the challenges that we are currently encountering with regards to resources, especially funding, we are prioritizing the populations that I mentioned, healthcare workers, pregnant women, people living with HIV, and healthcare workers.
Yeah.
I hope I mentioned healthcare workers, and key populations.
Yeah.
And I also wanted to, I didn't respond to one question that asked about integration leading to extra funding.
Yeah.
I just wanted to add that the NSP is currently being costed. So hopefully this will lead to extra funding for viral hepatitis, especially from the various sectors that make up the South African National AIDS Council, because we've got your corporate, we've got like the mines, we've got the private sector. So all this hopefully will be a sort of mobilization of more funds for the implementation of viral hepatitis activities, especially because now we've got more activities within the strategic plan. Thank you.
Thank you, Dr. Komotso. I think we'll have more discussion on costing, and there is a part in Nicholas' presentation also. So in interest of time, I think we'd like to close this discussion, but please continue to put your questions in the chat box. We'll have one more opportunity for this. And thank you. And with this, I hand over to Diana. Thank you.
Nicholas, we cannot hear you. The device is mute.
So, Nicholas, it's your turn now. And to introduce Nicholas Luman is Technical Officer, Testing, Prevention and Population Team at Global HIV Hepatitis STI's team at WHO Headquarters. Over to you, Nicholas.
Does it work now? I was already talking.
Yes, it's working now.
Okay, thanks. I hope it's working now. Sorry for that. Sometimes it unmutes centrally here. What I was saying, sorry, is that was a very good session and with great presentations and a good amount of discussion. I really think it was quite remarkable, you know, we know that now, how it immediately goes to the question of financing and the challenges in finding resources. And that is as well one of the rationales behind integration. And so that discussion was very valuable. In this second session, and this links up very well with the discussion, we imagined to really have another session that focuses in on the value of costing national plans or operational plans. This is obviously not a kind of perfect solution, but it really provides an important step in having a stronger engagement around resource mobilization. And I wanted to share a couple of examples from a multi-country grant that we had from the Hepatitis Fund, and Capucine has just been talking. So she works at the Hepatitis Fund, and we received a multi-country grant where we supported countries to cost their national operational plans. So just a few slides for me. Here, the first one, I wanted to show a couple of key shifts that we identified in our global health sector strategy to make progress in viral hepatitis elimination. And among all those, on awareness raising and increasing prevention and testing and treatment coverage, one that we've obviously listed as well is that there needs to be an increased amount of financial resource allocation to make further progress, and that many countries really struggle with that. And that's what we, again, just heard in the discussion. So it's a very important point. And again, costing national plans, as we will see, is at least one of the crucial steps, to have an engagement around resource mobilization and developing a resource mobilization plan. Next slide. Wanted to show as well that this is the monitoring and evaluation framework from our new global health sector strategy. There are impact targets, there are coverage targets. Those are the program coverage targets that you see. What I've surrounded in red is really one of the milestones that are new and have been extended, and that actually says that we have identified as a milestone the number of countries with costed hepatitis elimination plans. And we want that there are 30 in 25 and 50 in 2030. And in that way, we've heard in the poll that actually quite some countries said that they already have a costed national plan, even though half of them did not have that yet. But just to highlight that even in our global monitoring and evaluation framework, that is one of the important milestones. Next slide. And that comes I think, from an initial version of the document that Dr. Banda showed as well. I just wanted to show here as well that costing is one of the core components of strategic planning. As you can imagine, it goes from the situational analysis, priority setting, and then identifying the key components in terms of service delivery, the monitoring and evaluation framework, and really a good national or operational plan includes a costing and budgeting session that is well developed. Next slide. So in that framework of really wanting to increase country or the number of countries who have costed national plans, we rolled out, or we developed in collaboration with our regional and country offices, this grant, where this allowed us to develop a fully updated and new a national strategic plan in Uganda that was building on their first plan and to cost it, which was a very important exercise for this champion country and high burden country, especially for hepatitis B. In Sudan and Bangladesh, it allowed us to support developing more operational costed plans because they had a national plan that was framing elimination, but really needed to go into more detail with their operational planning, and we supported as well national plan development in Nigeria and one smaller island in the western Vipro region of WHO, that is Vanuatu. Next slide. What did we cost? We didn't want to go into too much detail in terms of technical discussion here, but I just wanted to show that what we costed are really the additional costs and resources that have been added in the National Strategic Plan to the health systems response. So we did not cost as well shared costs such as the infrastructure or opportunity costs. It is really the incremental financial costs that have been costed, and that has been done by a costing specialist and health economist that is based in Sri Lanka and that works with us on this in collaboration with the countries. Next slide. So my main messages was to share the 4 findings that we have been able to identify through that work and that we hope might apply to some of the work that you're doing and some of the work that we see in or that might be helpful for other countries. There is a form of internal lessons learned note that you see the cover there. It's not an formal WHO publication, but it can be shared with you, and you find some of those lessons and more detail on the costing approach in that document, and it will be shared with you in the chat, and then as well by the follow-up email where you will get all the materials. So what are the findings? One of the findings that we made and that we find is important is that in some way, many countries have elimination plans. Some of them are costed, some of them are not costed, and they do mirror often the global or the regional elimination framework, which is absolutely great and important, and that is kind of what is intended. But there is a small downside to that, potentially, that, you know, elimination is very ambitious and gives us very ambitious targets and criteria. And so there is a certain need to really develop more operational plans for example, for a 3, 4, 5 year period and cost them, and really to identify where to start with, what are the priority activities to make an initial progress towards elimination within this elimination framework. So that is finding number 1, that very, you know, macro elimination plans are important, but to really need to be planned out on a maybe more detailed level to make progress and define progress. The second one is that costing and planning should be really ideally be developed in parallel. So what that means is that what often happens is that countries develop a plan and then they cost it in the end, and then they see the cost implications in the end. What we try to do here, at least in some cases, is that we developed, and I hope Dr. Sarah will be talking to that a little bit. We developed an initial plan. We did an initial more preliminary costing, and we saw what was the cost drivers and how high the costs are. And then in some cases, we saw that that would be too ambitious, and we further prioritized the initial plan and then did the final costing. So when costing is used as an interim preliminary costing to see, am I actually on track? What would be, is this realistic? Then it can help us to further prioritize our plan, and that is needed in the resource constraints that we're seeing. Next slide. Another finding number 3 was that costing is very useful for then take it to the budget and resource mobilization. I think, for example, it was mentioned for the Global Fund, it might be very helpful that you have a costed plan that can be used for your negotiations, but that might be as well the case with other funders, and to do the health budget planning. For example, in Bangladesh, we hope that the operational costed plan can be brought to the negotiations of the next 5 years health budget. So that again gives a good foundation for those negotiations and discussions. And then the last finding was, which is a kind of a generalized finding, that it is important to include all stakeholders in most of those processes, in the decision making, and then in the dissemination back to them once the final plan and the costing is developed, so that it is shared and transparent. So I think those were, next slide, those were my findings, and I think Sarah can build on them and share her country experience. Back to you, Diana. Would you like to introduce Dr. Sarah?
Thank you, Nicholas, and thank you for the remarks and what you found in countries who had taken the exercise of costing their plans. And I'd like to reiterate what you said on the need that the costing of the is done parallel with the planning, so that the country is aware ahead of time and does prioritize what areas it will take forward with the NSPs. Without further ado, like now to introduce Dr. Sarah to share more and reflect on the experiences for developing a costed and prioritize operational plans. She's the viral hepatitis lead in the Disease Control Directorate of the Federal Ministry of Health in Sudan, and she led the process of writing the NSP as well as the operation plan for fighting viral hepatitis by 2030, along, of course, with the costing for the strategies. So, Dr. Sarah, I welcome you, and I would like you to go ahead and share with us your reflection. And I believe Nicholas will be coming ahead with this discussion, seeing how our audience can learn from the experiences in Sudan and ensure that they build with a costing component within the NSPs. Over to you, Dr. Sarah.
Thank you, Diana. Thank you, Dr. Nicholas, for reflecting on the experience of Sudan. And let me also express my appreciation for the continuous support of WHO to fight communicable disease in Sudan, especially for viral hepatitis, since they are the only agency who are supporting viral hepatitis. Okay, shall we start the presentation? Thank you. Reflecting on our experience, let me just introduce Sudan. Sudan is the third largest country in Africa with a population of about 45 million. And according to the World Bank economic classification, Sudan is a low and middle income country. And according to the WHO estimate, Sudan is classified among the highest burden countries for Hep B and intermediate tier for Hep C. The overall proportion of donor reactive for hepatitis B range between 3.6 to 4.8 and between 0.6 to 2% for SCB in the period from 2012 and 2016, according to the blood bank reports. The first round of the IBBS 2011 showed that overall national seroprevalence of surface antigen among FSW was 3.8, reaching up to 9% in some states, and 3.8 in MSM, reaching up to 8.5 in some states. And we have currently running IBBS. We are supposed to have a new estimate for that. According to the best available data from the first Federal Minister of Health Cancer Registry, also they reported liver cancer ranked number 7 of the 27 reported major cancers in the country. Next slide, please. Regarding this alarming picture, Sudan took the decision to have a national strategic plan in line with the global health sector strategic plan and the regional plan to fight viral hepatitis. And actually, it was not the only response toward fighting viral hepatitis. It was preceded by a roadmap, included the formulation of viral strategic plan, viral hepatitis strategic plan at the end of the roadmap. So we developed an integrated national strategic plan aiming for 7 years toward the elimination of both viral hepatitis B and C. And the development of the strategy was heavily engaging 10 key stakeholders in the development of the NSP, the operational plan, and also the costing exercise for the NSP. Next slide, please. For the costing exercise, and as Dr. Nicholas said, it is a very basic element in planning. You need to have the cost of what you wrote as a priority and as action you are going to implement. We were pretty ready by having a costing elements like health services, commodities, resources in terms of drug, vaccine, diagnostic kits, and other consumable and follow-up investigation and so on. And also we had the element for health system resources used in supply management, the infrastructure and human resources. And also we listed the soft activities needed for the implementation of the certain strategic intervention like the advocacy, awareness raising activities, training, supervision, and also the technical guidance and capacity building strategy needed. Next slide, please. So as steps for costing the NSB, we started with the costing exercise with the full detailed operational plan that we developed initially. and it was composed like with like 800 activity. And when the initial costing came out, it was very huge cost. And then we decided to revisit it again, and then and to do a prioritization for the plan. And it was the costing for a 2-year prioritized plan. And also after that, the costing forecasted for the remaining years. And after we had the final costing, the final costing, we also thought we are going to need like 2 scenarios for costing. As I said before, our strategy was an integrated strategy. So we have a very much cross-cutting with other programs like the MCH program for the EBI, the health program, expansion program, quality. Those are all were included in our strategy. So we decided to have like 2 scenarios for the costing in order to have to know the exact cost for activities related to viral hepatitis program or viral hepatitis strategy, and we have, and the other cost is related to the whole detailed budget for whole strategy for all entities. Next slide, please. And for the costing scenarios, when considering, we had 2 scenarios finally. We had scenario 1 focusing on all the intervention incorporated in the operational plan. The total annual cost of implementing the operational plan into 2022 was estimated to be around $21 million. With the scaling up of interventions, the annual total cost in 2025 was estimated to be like 45 million. And this scenario is for the whole strategy with the cross-cutting areas. And the other scenario 2, is for the total annual cost range from 8 million or around 9 million in 22, projected to be 30 million by 2025, and those for specifically the cost of the hepatitis program activities. Next, please. For the costing style, the costs were estimated and disaggregated by strategic direction, the priority area, and strategic objectives, strategic intervention, and the activities, detailed activities. When only actual incremental costs resulting from the NSP, scenario 2 were considered, the treatment, diagnosis, and creating an enabling environment were found to be the main cost driver, consuming around 89% of the total cost in 2025. Next, please. What was the added value of costing? Definitely, the costing was very important for us. After we finished the costing, we were immediately asked by the Minister of Health to report for the annual plan for viral hepatitis that year, and we directly submit our annual plan with detailed cost. The second thing, we were planning to do an advocacy, nationwide advocacy for viral hepatitis strategy, since it's the first strategy to combat viral hepatitis in Sudan, and we have the whole cost was disseminated with the advocacy workshop, and it was included a lot of donors, embassies, from NGOs, INGO, and even all the DG of the Minister at the states. We have like 18 states, and all of them were oriented about the strategy and the cost of the strategy, what was already there. Second thing was a big added value, also the prioritization, because even us, during our planning, we were not be able to figure where we can invest more. Is it vaccination of the healthcare worker, for example, or we should invest in bringing immunoglobulin, for example, for newborn? When the cost came out, we realized that there is an areas that is very clear that if we could invest in with the very low prices, we can add a lot of benefits at that area. And the last thing was the readiness. As I mentioned before, the Global Fund are now encouraging countries to apply for extra fund within the HIV grant for BLHIV, key population, triple elimination, and prisoners. And now we are doing this exercise, and we are just copy and paste from our costed plan to the template of the Global Fund. So I think the three major impact of costing I mentioned, we really benefiting from now. Thank you, and I think that is all.
Thank you, Nicholas, for sharing lessons from the multi-currency grant. The document has also been shared. The link has been shared in the chat box. And thank you very much, Dr. Sara, for sharing your experience of developing a costed plan in Sudan. And as you rightly said, the impact of the costing is important in terms of advocacy, prioritization, and also in terms of readiness. So these are very important lessons that we need to have. So we apologize that we are slightly above the time, and I request consent from participants for another few minutes more so that we can answer some of the questions, because many participants have raised questions regarding the funding, and there are specific questions that countries have got national strategic plan, but no funding. So there was a question whether WHO has got a startup funding, and Pascal's question is very clear that if the funds exist at the level of WHO that benefited some countries, what are the conditions for access to this funding? And the strategic plan exists, but applicability of execution poses problem for lack of means. So maybe since this pertains to WHO and multi-country grant, Nicholas, you may like to answer this, and then we can have one question for Sara from the audience. Thank you.
Sorry, thanks, Dr. Rivari. I mean, really just wanted to echo you. Very, very great how Sara really shows that how she, under her leadership, used, the costing and the work for advocacy, prioritization, and readiness. That was very, very nice, and should stimulate us. I mean, Dr. Pascal, we hear your question very well. I would say WHO is not a funding agency, so we don't have as such, catalytic funding mechanisms. We're a technical agency that supports country in many areas of normative and guidance, strategic planning, and many other areas, strategic information, as you know. I would really just like to say that many countries are in your situation where they have developed an initial plan, and that resource mobilization is difficult. There is no dedicated funding mechanism for viral hepatitis. I think every country has to find their own solutions, and there will always be a little bit a patchwork of solutions. There you can engage with funders that are present in your country from the development sector. The Global Fund is something that we heard now, at least to tackle parts of your viral hepatitis response. Health budgeting and inclusion in the national health budget and the negotiations there is another piece of the response. And then building in the insurance and universal health coverage framework are others. There's certainly other pieces to it. There's no simple response to it. We are sorry, but every country has to see how they best go into those negotiations. But having a plan, and a costed plan, I think that's what we learned, is a basis for those discussions, and sometimes brings at least some form of progress to the response. I hope that's a good somewhat not response, but reflection. Back to you, Dr. Rivari. I see that Dr. Khomotso has her hand up, I think.
Dr. Khomotso, please go ahead if you have a question.
Thank you, Dr. Sara, for a very great presentation. I just wanted to ask, just going back, our plan was actually costed and it was approved as it was, but we faced challenges with the insufficient funding. So I want to know, does costing mean funding? Does costing mean guaranteed funding? And how do you communicate the costs of the interventions without seeming to be, I mean, you mentioned the scenarios. I mean, that's one of the scenarios we also thought of prioritizing other populations. So how do you do it without appearing to treat other groups more special than other groups?
So I think this question is specific to Sarah.
Thank you, Modzi. Yeah, can you hear me?
Yes, please go ahead.
The term of the scenarios, actually, as I said, we had like 10 key stakeholders, like the expanded program for immunization for one as a major key stakeholder, who are entitled of the first dose and the triple dose of the pentavalent. And also we have the reproductive health program, and and also we have the blood bank and the National Public Health Laboratory and all those stakeholders. When we had the costing by scenarios and by specific strategy, because we have like 9 strategic objectives, each objective is entitled for each stakeholder. And by this, we could advocate and we could reflect on the cost of our plan within their plans. Even for the blood bank, for example, they had the plan, but it was not costed before. We brought the cost for them and we said, now your plan is costed and it's here and let us work for it together. So that's how it's not, we did not prioritize like and a group over the other. It's just like we are trying to fit any objective or any group to the entities entitled of. For example, PLHIV is the mandate of the HIV program, and they have to work within PLHIV and the key population and in the triple elimination. And here it comes a sense of writing the request for the Global Fund together and to work. It is their mandate, and the reproductive health also mandate. And by the way, the political, not the political, but the technical working group of those stakeholders, initially it was created, or it was planned by the Undersecretary General of the Ministry of Health. Who is the one who established this technical working group to work for the NSP, and by default they became responsible and entitled for the implementation of viral hepatitis strategy. I hope I answered your question.
Yeah,
clearly.
thank you, Sarah. I think that was very useful. So in interest of time, I think we have to now come to the closing, and I request Nicholas for the closing remarks. Over to you.
As we're running over, Dr. Rivari, thank you very much. I think it has been a very good session with a lot of questions and one of our most animated discussions due to your chairing as well in this webinar series. I think I just want to thank the presenters and for the participants to stay on longer. It was a lot of things that were shared. There is a feedback survey that will be now in the chat that you can respond to. Please, if you have that 5 minutes, the link will still stay open a little bit, the Zoom link, so that you can respond to that chat. And we hope to see you on the 13th of April for our next series, and hope that you can join again. It was always very well attended, and I thank you all very much, and the colleagues here and in the regions and everywhere. Thanks.